I would like to introduce our next keynote speaker, actually. We are all waiting to hear Dr. Vasavada speak. Who does not know him? Not only in Gujarat, all over India and all over the world. I think there is no cataract conference which is complete without him. And he was actually born in Rajkot, so we take some vicarious pride in that. He did his MS in Baroda in 1975. He returned from UK in 1983 after getting his FRCS there. Started his private practice in 1984, set up the Ila Devi Cataract and IOL Research Center in 1991. To most of the people, and to me at least, he is the god of phacoemulsification. Some people call him the Greek god for his dexterity, the voice, the speech, and the skills, the art. Everything is there with him. Once you listen to him, it's mesmerizing. The first talk I heard from him was in 1994, and I'm sure I've not heard better cataract talks than Dr. Vasavada's. He's also a PhD guide. He follows cricket passionately. He has been recently to the Mount Everest, and he's been voted in the top 100 in the power list of the most influential figures in ophthalmology. Blessed with twin daughters and a son, all well-known ophthalmologists and having a great name for themselves already. His keynote address for this webinar would be raising the bar and soaring high. Over to you, sir, for your talk. We're all looking forward to it. Please share your screen.
Thank you, Mukesh. Because he was so educative, I'll be delighted to listen to him rather than talk. But whatever you're going to hear, I must acknowledge Dr. P.N. Nagpal's influence on my upbringing, and I learned so much from him that I must say thank you very much, sir, at this time, and also recognize the contribution of our own people like Dr. Mathur, Dr. A.K. Bavishi, Dr. S.K. Narang, and so many late, I can go on, Vasant Parikh and so on. So if I've forgotten, everybody has contributed to all of us upbringing, but raising the expectations and performance is something that is very enjoyable. And many of you sitting here today have tasted it so well as we heard this now. But it's essentially, it's the how you judiciously make this science to an art form or an art converted into science, as you heard in the last 1 hour. And like our many patients who want stars and moon for paying nothing, if you want to achieve and grab those stuff up there, there are good reasons and you should try that. And I think to me, it is that curiosity in your mind that Sanjay Gadre said, the fire. You must be curious enough to question everything you do and see from your mentors and others, and that will help you to evolve yourself. And that eventually will really help you to cope with the change which is so constantly happening around you, in you, and in your science or whatever you're practicing. And if you see in a mathematic form, it is absolutely a need of the day that you better understand that. And it is our moral, legal, and all kinds of responsibility that we really keep evolving ourselves in whatever profession and whatever we are doing. But particularly for us in practice, at the end, the bottom line is not the money and the modern money language bottom line, but the quality care, something that you would do for yourself, you would wish that you would be treated or advised like that, is something is the bottom line. Now, I've learned from the people I mentioned earlier, but so many other colleagues, how do we try to do that? But the first important thing, as I said, is improving yourself. Improving yourself, as Dr. Martelli said, yourself, your soul, and whatever way you want to improve yourself, surely professionally and technically, but you need a support, and support could be anything. And in that team, Sanjay had a God, but you can have anybody in your team. And finally, in your practice, improve the patient experience. And improving self is something not difficult if you remember that learning is all along your until the last breath, you're going to learn lifetime. And one of the tricks to learn is that you need to pay attention to the details. In other words, you should be very observant. And that's what our teachers in medical colleges taught us, that develop the power of observation. And we have converted that into clinical science and clinical art when we talk to the patient and when we examine the patient. So the devil is in the details, and that will make sure that you keep learning, and you can always question what you did. I taught how good the intracapsular extraction is over extracapsular in my lecture series for FRCS students in London, and now I am saying that's the opposite. So please revisit your strategies time and time again, because you need to change as everything is changing in yourself and around you. And the team approach is something which is very important. And finally, for our practice, for limited objective, you must give them a very happy experience, very satisfying experience. And the simplest way you can do is produce results and upgrade your care right from the beginning of listening to him, examining him. And I knew this when I came back from England, because I realized and learned there that you need to spend a lot of time. I never had that learning in a very busy OPD in Baroda, where we had to see 100 patients in 2 hours. But when I came back, I used to do that. But then again, with the busy practice, people forget. But more time you spend with the patient, better you will become yourself, and so will be the patient's benefit. But in short, rather than looking at his disease like a cataract or glaucoma or whatever, see the patient and not the disease or eye. See, it's not a acute glaucoma or a uveitic cataract that's sitting in front of you. There is this gentleman or a lady sitting in front of you with this background, the family is there. So you're treating the patient and everybody else. The technical part or technicalities become an important contribution, but relatively minor. So that approach, you will develop yourself, more time you spend, and you will learn a lot from the patient. The best teachers are your own patients. Now, also understand the benefit that you will get from other colleagues, from your other team members, but importantly, the other experts in the different diseases, like the physician, the psychiatrist, the retinal specialist, and glaucoma, and so on. So try to join hands for the benefit of the patient, because at our top priority is how can I help this patient and the family to my best abilities. And you might not have best abilities yourself every time. But the key now, and which is becoming more and more relevant and more important, is the standards which our teachers and our stalwarts taught us and set for us to follow. But unfortunately, in this competing age and the world is changing, degradation, and I'm part of that degradation. We have forgotten, or we are not able to practice that ethical values as much as you can. But as Dr. Nagpal has said a number of times, always respect the patient's feeling, the results produced by the treatment given by other colleagues, and so on. And would you get operated yourself with this degree of cataract or this degree of disease, is there any other option apart from surgery which may be less remunerating to you? Would you like to do that and consider for that person sitting across you? So in other words, when you see a patient, say for example, on a slit lamp, remember it could be you sitting on the other side or your own loved ones, and you advise and see and take care the way you would have done yourself. So I think this is something we keep forgetting in this pursuit of achieving the excellence and the glamour and monetary benefits. And the best way to learn is to teach. But the problem is that it's okay in medical colleges. How can I teach it in private practice? And once again, I think I must say that I may not be wrong, but Dr. Nagpal started fellowship program in India, or maybe Badrinath at the same time, first thing to teach. And that showed the way for many of us who duplicated that kind of concept and taught. And in the return, we learned a lot. And I can vow I learned much more from the fellows and team members than ever from anybody else. The challenges are that it will take up your time from a practice and from your family and from other hobbies of your life. And in fact, not only there is no apparent gain, but there may be some loss at the first sight. And your well-wisher and friends would say, why are you doing it and training your own, your colleagues who are going to compete with you? But the thing is that is the best way to learn and do some satisfaction to your own soul, as Dr. Matalia said. Like teaching, you can be curious, and Jagdeep showed how much research he is doing, and we will surely have one webinar from you, Jagdeep. But concomitant research and clinical practice can happen, and they are very vital for the growth of yourself, for your practice, for your patients, and for the society in general. So I think knowledge gained through this research will be applied to the clinical practice, and it will do a greater good to the science and society. But Jagdeep has the gene, but you can also mutate your gene, which may not be original that way, but you can modify that gene to some extent and develop that curiosity gene and try to address, if you cannot, ask, read, and interact with it. And that interaction will improve a lot. But remember, charity is not an excuse to offer inferior quality. Quality always should be the bottom line. And what are the implications? Obviously, for your limited gain in the practice, patients will benefit, the science will benefit, and you will have your personal growth, not only monetary, but more importantly, individual, as was referred to as your soul, as your mindset, your caliber as a human being, humility, and whatever else you can add these adjectives and ornate that. But that personal growth would invariably happen. Now, at the moment, this is very important because at the moment, whatever the reason, the society, the public, non-medical people have different views about doctors and medicine. Not everybody, but quite a few of them. And therefore, it is very important that we practice what have been taught by the expert in this webinar and others, and we remain cohesive and coherent with our colleagues in medicine in general and behave as a family, because otherwise our future is not very good. And talking about the future, remember, and this is what my colleague Dr. Shettle produced for me many years ago, that the MBAs, as they age, their value, like the wine, goes up and they get more and more remuneration. But remember, we are not like that. We are like plumbers and technicians. So as we age, we go down. Dr. Vasavada's hand tremors. Nobody comes to him. And as we age, we really degrade in our recognition and remuneration. So we must understand that and prepare yourself in many ways so that we lead a meaningful professional life when we are very active, but also for our patients and our communities and ourselves and family in the time to come in the future. So finally, to summarize, please try to develop that gene, need to know. Curiosity is the one word I would emphasize again. And if you pursue, as you heard in the second talk with the fire, you will find your way and develop a passion in the way you want to. You may develop passion in your subject of ophthalmology or subspecialty. You may develop passion about your natural nature, the fitness activity and artistic and whatever else, but try to be passionate, and it will happen automatically if you really follow that path. And I'm trying to discover that to some extent. But remember, patients are at the heart of all that we do. And whenever you encounter a patient on operation table or on your clinical diagnosis, remember it could be you or your beloved one. So keep that at the bottom line. But if you do that, it is possible to soar high and follow the path all the Stalwarts has shown us over the years. So thank you very much, Rajkot Ophthalmic Society, Mukesh, Suketu, and many other friends. Thank you.
Thank you, sir. Amazing. Every word we hear from you is the gospel, actually. And what can we say? It was really, really amazing. And at this point, I would like to ask you that way back in 1983, when you decided to come back from the UK, after you actually got a cushy job there, I suppose,
yes.
What made you come back?
Well, it is a very personal thing. And although my family was never in defense as such, but I'm as patriotic as anybody else can be. And I never wanted to live anywhere else, but I was actually offered a consultant position in Moorfield along with the King's College Hospital. But I said my people need me more. So it is all emotional, and maybe I'm wrong or incorrect by the mathematics, but I'm very happy that I made that decision. I'm so happy that I'm back.
Not one
I'm learning so much from you guys over the years that I would not have been able to do that in that little island there.
Definitely not 1% wrong. Anybody would agree. Listening to you, there was a master lecture. Dr. Suketu wants to ask you something, sir.
Yes,
sir. Yes, sir. First of all, it was very nice and informative presentation, sir. Just one question to sum up the meeting. What are the 3 pieces of advice you would like to give the young ophthalmologist of today?
Younger people? Yes. I think number one, if you are beginning in the practice, particularly the practice, be realistic and be patient, because you invested so much of money and you want to recover that money and the glamour and reputation. Be a little patient. Your day also will come. If my day has come, your day will come quicker. So be patient, number one. Try to resist the temptation of advice which will generate more remuneration for you or reputation. So in other words, if a procedure, investigation, surgery is needed and you put yourself in it, and if you think they will benefit, please do that, but not for the sake of that benefit. And third thing is by saying something negative about the treatment received by the patient, you may be tempted that you will take the patient on your side, but that's the biggest mistake, as I've been told, and I agree that please be ethical and respect to the patient, first of all, and also to the colleagues and everybody else who were treated and who have been in your past history. Be knowledgeable about the contribution by the senior people. You may not have seen them, you may not have heard them. And we all are the product of so many people who are directly, indirectly influence us. So these are the 3 things. Thank you, Suketu.
Wonderful, sir.
Thank you, sir.
I can tell you that this speech today will be a landmark speech, and it will be all over the place for all ophthalmologists for a long time to come. Thank you so much for honoring us by being here.
Thank you. Thank you.